Thank you, Mr. Speaker, and thank you to Mr. Pallone for your friendship and for your leadership on the committee. You have been an extraordinary leader in the healthcare space, and just want to publicly thank you for your work, as well as to Dr. Burgess. Dr. Burgess, I've been on the committee now for more than 10 years, and I've watched you and Mr. Walden and others and Mr. Barton engage in debate. But one thing for sure, I know that all of you are seriously and totally committed to improving health outcomes in this country, and I want to thank all of you for your leadership. Mr. Speaker, I rise today to urge my colleagues to support S-292, the Childhood Cancer Survivorship, Treatment, Access, and Research Act, or commonly referred to as the STAR Act. Along with Mr. McCall and Jackie Spear and I introduced H.R. 820, which is the House companion to S-292. Over 85% of the House has co-sponsored this bill. It is therefore my great honor to serve as co-chair of the bipartisan House Childhood Cancer Caucus. Through the work of this caucus, I've had the opportunity to work closely with pediatric patient groups and stakeholders to promote legislation that can help save and improve lives of young people. Passage of the STAR Act has long been a goal of those patients and of the Childhood Cancer Caucus, and I'm grateful that the House is poised to send this important piece of legislation now to the President's desk for his signature. 16,000 children in the United States are diagnosed with cancer every year. Many of those have limited treatment options. The STAR Act, Mr. Speaker, is an important piece of legislation that will expand the opportunities for childhood cancer research, improve efforts to identify and track childhood cancer, and enhance the quality of life for childhood cancer survivors. Childhood cancer remains the leading cause of death in American children. As many as 2/3 of childhood cancer survivors suffer from late effects of their disease or treatment, including secondary cancers or organ damage. That is why passage and enactment of this legislation is so important. The bill enhances research on the late effects of childhood cancers, improves collaboration among providers so that doctors are better able to care for survivors as they age, and explores innovative models of care for childhood cancer survivors. When enacted, 292 will help to advance pediatric cancer research and child-focused cancer treatments, while also improving childhood cancer surveillance and providing enhanced resources for survivors. This bill, Mr. Speaker, is the most comprehensive childhood cancer legislation ever slated to be passed by this Congress. The STAR Act will give young cancer patients and their families better access to life-saving treatments and the support they need even after beating cancer. I strongly urge my colleagues to support this legislation. I thank all of the leaders of the committee for their work, and at this time I will yield back the balance of